Nurse leaders' positive influence, helping to improve and change current practice protocols to better patient outcomes. Hello, my name is Nicolle Coletto. My nurse leader that I interviewed and worked with on this project is a leader on our telemetry unit, Cesar Stella Maria. I also needed to interview another nurse leader to help put this project into place, which was Sheila Gallagher. I also interviewed Sandra Gormaggio, who is a registered dietitian. And lastly, I interviewed our infections control nurse, Hapte Ferneri. Together, we all work at Providence Little Company of Mary in San Pedro, and we hope to help our hospital improve and catch early signs of sepsis before it gets worse. So, my nurse leader and I, Cesar Stella Maria, decided for our Plan, Do, Study, Act project to improve our hospital's sepsis protocol on both the telemetry unit and also the medical surgical unit. The practice methods that were in place prior could be considered inefficient for catching early warning signs that a patient was becoming or possibly becoming septic. On our acute care hospital floor, by improving certain health protocols such as the sepsis protocol, improvements in patients' health can be made sooner with hopes to avoid deterioration of health. Working on a telemetry unit or a medical surgical unit, nurses can have 4 to 5 patients at one time. Having a simple protocol to follow for the sake of catching early warning signs of sepsis is quite possible. Cesar and I, with the help of others, have decided to implement a new sepsis protocol for both of these busy high-stress units to help improve the quality of patient care. Sorry. Okay. A little history about Cesar, my hero and my leader. Cesar is a 48-year-old male born in the Philippines. He received his nursing degree there and later arrived in the United States. His 23-year-long nursing career began in New York and now currently practices at Providence Little Company of Mary in San Pedro, which is where I met him. He has worked in many different units throughout the hospitals, including the ICU. My favorite thing about Cesar are both his knowledge and his kindness. He is a wonderful leader to all staff and can honestly solve any patient problem. As a new graduate 3 years ago, he helped pave the way for me in many ways, and this is why I selected him to help me with my class project. So what is sepsis? Actually, that last picture was just a picture of my hospital. What is sepsis? According to sepsis.org, sepsis can be defined as the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and death. In other words, it's your body's overactive and toxic response to an infection. That was from the Sepsis Alliance 2018. A few sepsis facts. According to the results from sepsis.org in 2014, sepsis has been named the most expensive inpatient cost in American hospitals, averaging more than $18,000 per hospital stay. In 2014, there were over 1.5 million sepsis hospital stays, which works out to cost $27 billion each year. On average, approximately 30% of patients diagnosed with severe sepsis do not survive, while up to 50% of survivors suffer from post-sepsis syndrome. This all being said, early detection is the surest hope for survival and limiting disability for survivors. So what is Providence Sepsis Protocol? Current protocol in the emergency department is when a patient arrives, a full body assessment along with labs, cultures, or x-rays takes place. Qualifying sepsis criteria means 2 of the following signs and symptoms must be present: hyperthermia greater than 38.3 degrees Celsius or hypothermia less than 36 degrees Celsius, tachycardia greater than 90 beats per minute, leukocytosis greater than 12,000 white blood cells or leukopenia less than 4,000 white blood cells or greater than 10% bands, acutely altered mental status, tachypnea greater than 20 breaths per minute, and then lastly, hyperglycemia greater than 120 milligrams per deciliter in the absence of diabetes. And that is from Sepsis Alliance 2018. So the current protocol. So now that a patient we're going into the acute care floors. On acute care units, continuous monitoring of the patient must take place. A key target in identifying sepsis early is called the Modified Early Warning System, or the MUSE. By taking a complete set of vital signs, which includes temperature, heart rate, respiratory rate, blood pressure, O2 sat, and sedation level, a MUSE score involves assigning a number between 0 and 3 to catch each of the 6 vital signs. The sum of these scores of the 6 vital signs yields the patient's MUSE score. That was from the Institute for Healthcare Improvement 2018. So current practice at Providence Little Company of Mary does in fact accumulate these MUSE scores currently. However, nothing gets done if the scores are out of range. The purpose of the MUSE system is early identification when a patient is deteriorating. After 3 hours, this is from Montero 2006. After 3 hours, every hour delay in receiving antibiotics increases the risk of mortality by 5 to 15%. After reviewing some research articles, I found that utilizing the MUSE scores can be a wonderful tool to improve outcomes of patients. So the new sepsis protocol plan. The same 6 vital signs as mentioned before: temperature, heart rate, blood pressure, respiratory rate, and O2 sat, and sedation level will be used for our protocol. The difference is now when a MUSE number is assigned, we will pay attention and set in place a new policy. The new policy states that if a MUSE score of 4 occurs, the nurse is to repeat vital signs every hour times 2 and report to doctor as well as nurse leader. If a patient receives a MUSE score of 5, the nurse is to call a rapid response. A rapid response can be defined by AHRQ as when a patient demonstrates signs of imminent clinical deterioration, a team of providers is summoned to the bedside to immediately assess and treat the patient with the goal of preventing intensive care, cardiac arrest, or death. So the goal of the new updated MUSE policy is that everyone working on the medical, surgical, and telemetry units will work cohesively together with the charge nurse leader. If a MUSE score of 4 occurs, charge nurse and doctor will be notified, as well as repeat vital signs every hour times 2. The goal of notifying the charge nurse leader is so he or she will know that this patient is requiring extra time from the primary nurse, and that particular nurse may need help so that the other assigned patients to this nurse will not be forgotten. In addition, when the MUSE score during a set of vital signs is a 5, a rapid response will be called, and again, if the doctor is not already present, he or she will be notified. We're going to increase the vital signs frequency to every hour times 2. If a patient remains a MUSE score of 5 for 3 consecutive readings, we're going to request order for possible transfer to higher level of care. Depending on the patient's status and prior comorbidities, the palliative care team may become involved. Another goal that can be included for determining a septic patient early on is their nutrition intake. In interviewing one of our hospital dietitians, Sandra Gormaggio, she explained the importance nutrition makes in healing an ill patient. An article from the National Institute of Health states when digestive tract is functional, nutritional therapy must be initiated within 48 hours of intensive treatment to reduce protein loss. Sandra agreed with those results, but stated that nutrition does not need to be rushed if the patient is in critical condition. She also states that she is responsible for checking on patient charts to be sure that they are not going any longer than necessary without the proper nutrition. She will contact the doctor to find out why they are not being fed, whether orally, enterally, or parenterally. Teamwork in any of these events is imperative to not only the patient who is possibly deteriorating, but also to the other patients who may need attention and the primary nurse is preoccupied. As a team, we need to help the floor and be sure everyone is safe. In interviewing Caesar, this was a priority for him. So data collection and analysis, basically we utilized Sheila, our nurse leader, the other nurse leader who I interviewed, to help bring this plan into action and measure the adherence to the new protocol. So we're going to announce updates during our daily huddles. And by updates, that's the compliance. Well, a goal selected was 87% compliance to our new Muse score procedure. And then we're going to post the results on the bulletin board near the nurses station for viewing and referencing during the daily huddles. This is a picture actually on the right of the actual thing we have hanging up now on the bulletin board. And as you can see, the bottom has the months, and it's red because we are not quite there. It'll show on the next slide, but the telemetry unit is at 72%, and then the medical surgical unit is at 78%, and the goal being 87. And in that blank box is where we can write our percentage. So that will change monthly, but our goal is 87%. Okay, and then, sorry. I have the results of the July compliance from both units. Medical surgical 78%, whereas the telemetry unit was 72%. When we have our daily huddles, the results from adhering to the Muse sepsis protocol gets read aloud. I notice a sense of pride when we say the percentage in the huddles. People were clapping. That was kind of cool. A group of caregivers clapped. Although we were not at the goal rate of 87%, we are still doing pretty good for our first month. In addition, another way both Caesar and I have noticed a positive change on the units is an overall group effort to help one another. Now that there is an inevitable, more frequent, rapid responses. Since this is now part of our protocol, there's more rapid responses. And Caesar has noticed other nurses helping out the other patients for the primary nurse involved in the rapid response. And that is all. Just in conclusion, by improving patients' care and collaborating as a team with fellow coworkers, a feeling of employee morale has improved on both the telemetry and medical surgical units. Nursing requires teamwork at times and a leader always. Both certainly help to make things run smoother when the staff works as a team to help improve patients' health outcomes. Increased teamwork has a positive effect on job satisfaction, staffing efficiencies, retention, and care delivery. That's from Kaiser and Wester's 2018. With these types of results, this will help improve the sepsis protocol to continue to be an active part on these two units. If the results continue to show improvements, which we hope, in patient outcomes, perhaps other units will be able to implement the new protocol to their units. Thank you so very much. And these next slides are just my references. Have a good day. I stopped. But I don't know why it's still sort of blinking here, but I'm not.
It's still recording.
No, it's not.
Yes, it is.
No, it's not. I stopped.
Because that means it's recording.